This is not a 2-hour guide to the coronary circulation. What I wish to do is to cut the fluff and give you only high yield facts that will come to use in test day and also you will remember for the rest of your life. So without any further ado, let's get into the video. To understand coronary circulation, you should know the basic physiology of cardiac cycle, and also you should know the basic concept of transfer. For any transfer to take place, there are two prerequisites. One should be willing to give and the other should be willing to take. Similarly, the coronary arteries should be willing to give the blood and the myocardium should be willing to take the blood. Now look at this picture. This picture represents the ventricular systole. This is also known as the rapid ejection phase of the heart. इसमें blood इतना तेजी से eject हो रहा होता है that it does not get time to go into the coronary arteries. तो सिस्टोल में coronary arteries में blood जा ही नहीं पाता because it gushes past through the aorta and into the body. The question arises, when does it go into the coronary arteries? That is during the diastole. Also the isovolumic relaxation. मतलब ventricles relax कर रहे हैं but उनके अंदर का volume अभी भी same ही है. That is when the blood stagnates above the valves and goes into the coronary arteries. This image shows that the cardiac muscle is supplied by a rich subendocardial plexus. However, during systole, this endocardial plexus gets contracted and it does not get the blood. It is because of these two primary reasons that the myocardium gets perfused during the diastole and coronary blood flow is very less during the systole. Now that you have understood this, इससे एक important clinical correlation भी निकल के आता है. Look at this image. This is the epicardium and this is the subendocardium. यहाँ पे अगर ये coronary artery obstruct होगी तो natural सी बात है जो उससे सबसे दूर वाला एरिया होगा वहाँ पे necrosis होना पहले शुरू होगा और पास आएगा towards the epicardium. Therefore, subendocardial infarcts are more common than epicardial infarcts because they are farther away from the coronary artery. Also systole में myocardium tightly बंद हो रहा है and coronary arteries में blood नहीं जा पा रहा. This is the exact reason why subendocardial infarcts are more common. जब भी कोई blood supply पढ़ाता है ना, they always begin with the arteries. However, तुम्हें याद रखवाने के लिए I will begin with the veins. This is the anterior surface of the heart and this is drained by the small cardiac vein and the great cardiac vein. These veins will drain posteriorly and go to the posterior surface of the heart जहाँ एक बहुत important structure आ जाता है, that is the coronary sinus. The great cardiac vein drains into the coronary sinus and also the veins that I told before. There are two main coronary arteries, the left coronary artery and the right coronary artery. जो LCA होती है वो immediately दो branches दे देती है. The left circumflex because it curves around the heart, that is why it is called circumflex, and the left anterior descending. This is also known as the widowmaker's artery because सबसे common MI left anterior descending के ही occlusion से होता है. Right coronary artery will give a right marginal branch and will go backwards to give the posterior descending artery. ये posterior descending artery clinically काफ़ी significant है जो मैं आगे वीडियो में समझाऊंगा. The right coronary artery also gives two very important branches, the AV nodal artery and the SA nodal artery. तो इससे हम clinically correlate कर सकते हैं अगर right coronary infarct हुआ तो उससे हमें electrical abnormalities मिल सकती हैं. I will be discussing the complications in detail in the next video. So if you're here with me till now, you know कि coronary arteries निकली हैं aorta से and ये arteries arterioles बनाएंगे, capillaries बनाएंगी and then veins में वापस drain कर जाएंगी. So you should be knowing which artery is corresponding to which vein. तो जो left circulation है that will correspond to the great cardiac veins and the right circulation will correspond to the small and middle cardiac veins. Now let's come to the concept of dominance. The concept of dominance is actually very easy. However, लोग इसको बहुत overcomplicate कर लेते हैं. The basic concept that you need to know in this is that dominance is decided by the posterior descending artery. जो भी coronary PDA को as a branch देगी, that will decide the dominance of the heart. If it is the right coronary artery, then it is a right dominant heart. And if it is the left circumflex artery, then it is a left dominant heart. And in rare cases, it can also be a mixed dominant heart. Now let's correlate this clinically. इससे क्या क्या problems arise कर सकते हैं. If it is a left dominant heart, तो जो infarction की territory है, that will become very big. And also, the right side controlled the rhythm. Remember मैंने क्या बताया था? The SA nodal artery and the AV nodal artery, both are given by the right coronary artery. If it gets occluded, it will cause electrical abnormality. The AV nodal and the SA nodal artery can be given by the left coronary as well. So इससे complications arise होंगी. These complications I will discuss in the video of complications of MI. Look at this image. Pause the image and try to find कौन सा dominance है. Because the right coronary is giving the posterior descending artery, this is a right dominant heart. As you can see, the left circumflex is giving the posterior descending artery. Therefore, this is a left dominant heart. Now look at this image. Isme, the posterior descending artery is arising from both the left and the right coronary arteries. So this becomes a mixed dominant heart. However, this is actually very rare. But हमें rarity and entrance exams का तो correlation पता ही है. So with that, I bring this video to a close. The key takeaway of this video was why the coronary blood flow is so low in the systole and what decides the dominance of the heart, and इन दोनों के clinical correlations क्या हो सकते हैं. With that, I bring this video to a close. If you did not understand any part, try to go back and rewatch this video and also share it with your friends. I will see you in the next one.